Hello, everyone, and welcome. Today, we're going to do a quick revision session on a topic that affects so many of us, allergies, and how homeopathy looks at them. So, let's get right into it. All right, so the big question right off the bat is, how exactly does homeopathy approach allergies? What's the game plan? Let's break down the core principles behind it. Okay, first up, Section 1, Homeopathy's core principle. This is really the bedrock of the whole treatment philosophy. So this whole approach is built on one major idea, and it's summed up in this Latin phrase, similia similibus curantur. Now, what does that mean? It basically translates to let like be cured by like. The concept is pretty interesting. It says that if a substance can cause certain symptoms in a healthy person, a specially prepared or potentized form of that same substance can be used to treat someone who is sick with similar symptoms. This process of potentization involves a lot of dilution and shaking. And this whole concept, the law of similars, is really the key to understanding the homeopathic view on allergies. All right, moving on to Section 2. Now we're getting into the practical side of things, allergy triggers and their remedies. We're going to look at a kind of symptom-based guide to see how this all works in practice. Okay, let's start with stuff in our environment. Things like dust, smoke, and so on. What's really important to get here is that the remedy isn't just about the trigger. It's about your specific reaction. So for instance, say dust or perfume makes you sneeze and itch like crazy, that points towards a remedy like Histrion. But what if that same dust makes you wheeze instead? See, now we're looking at a completely different remedy, maybe pothos futitis. And if your allergies get a whole lot worse in damp, cold weather, then a homeopath might think of dulcamara. The main takeaway? It's all about matching the remedy to the exact symptoms, not just saying, I have a dust allergy. And you know what? It's the exact same logic for food allergies. The remedy isn't for milk allergy, it's for how your body reacts to milk. So if milk gives you digestive issues and diarrhea, that might suggest magnesia carbonica. But if it's fatty foods or pork that cause problems, the remedy could be sepia. It gets even more specific. Let's say sugary foods give you gastric trouble and you feel anxious. That combination points towards something like argentum nitricum. So I'll say it again because it's so important. It's less about the food and more about your body's unique reaction. And let's look at our last category here, drug and other digestive issues. Say someone gets a skin rash after taking antibiotics. A homeopath might consider sulphur. Or what about that feeling after too much rich food or ice cream? Pulsatilla is often associated with that. But here's a classic detail. It's especially considered if the person feels completely thirstless. How specific is that, right? It just goes to show you how each remedy has a super detailed and unique symptom picture. So this all leads to two main ways of tackling the problem. Think of it as short-term versus long-term. On one hand, you have symptom-based treatment. This is for the right now. You're having an acute allergic reaction, and the treatment addresses those immediate symptoms. But then, on the other hand, there's something called constitutional treatment. This is the long game. It's for people who get allergies again and again. The goal here is to address what's called the chronic allergic constitution, sort of like treating the root tendency to be allergic to hopefully reduce how often it happens. Okay, let's switch gears a bit for Section 3. What does the scientific research say about all this? It's a good question. We're just going to take a neutral look at some of the findings that have been published in clinical literature. So people have definitely looked into this. For instance, there was a study back in 1994 published in the well-known journal The Lancet, which looked at allergic rhinitis. It suggested that there was some improvement in symptoms compared to a placebo. You'll also find other research like in the Homeopathy journal and some observational studies that have noted improvements for things like rhinitis, asthma, and eczema. But, and this is a really, really crucial point that the researchers themselves always highlight, there's a consistent call for bigger, better, more controlled studies to get really solid, conclusive answers. So that brings us to Section 4, the clinical strategy. You might be wondering, how does a practitioner actually figure all this out? Well, it's not just guesswork. There's a very systematic process they follow for each case. And this process usually has 5 key steps. Step 1 is pretty straightforward. Identify the trigger. What's causing the allergy? Then, step 2 is all about the modalities. That's a fancy word for figuring out what makes the symptoms better or worse. Like better in open air or worse at night. Step 3 goes deeper, looking at the person's overall mental and constitutional makeup. Then comes step 4, repertorization. This is a very methodical step where they use special books or software to cross-reference every single symptom to find the best matching remedies. And finally, after all that analysis, we get to step 5, prescribing that one single individualized remedy that fits the whole picture. All right, everyone, we are now at section 5, and I really need your full attention here. This is, without a doubt, the most important part of this entire discussion. It's a crucial medical warning, so please listen very, very carefully. So the critical question is this: when should you absolutely not rely on homeopathic treatment? When is getting immediate emergency medical care the only option? Okay, if you see any of these signs, what you're looking at is a medical emergency called anaphylaxis. The signs are severe trouble breathing, swelling of the throat or the tongue, a sudden, sharp drop in blood pressure, or fainting and collapsing. Any single one of these is a sign of a life-threatening situation. Please do not try to treat this at home. This is when you must seek urgent medical help immediately. There is absolutely no time to delay.